Welcome, everyone. My name is Michael Winters, and this is the course on psychological self-care during the coronavirus. And I'm very, very happy today to be interviewing Dr. Stefan Schulenberg. Dr. Schulenberg is the director of the Clinical Disaster Research Center and a professor of psychology at the University of Mississippi. He is a scholar, a researcher. He's edited multiple books, and I've known him since he was a graduate student, and really know him to be the ability to take a very complex subject and educate on it in very simple form. So I'm very glad to have Dr. Schulenberg. One other thing I need to mention is that his bachelor's degree was at the University of Houston. So he does have some Houston roots, even though he's at the University of Mississippi. And his program there, the Clinical Disaster Research Center, really got started with Katrina and really kind of was the premier research center on the response to Deepwater Horizon oil spill several years ago. So he has a ton of knowledge, and so I'd like to just welcome you, Stefan. Thanks for joining us.
I appreciate it. Appreciate the opportunity to be with you. No pressure at all. That's a great introduction. I will try to live up to it. But no, I'm just glad to be here and be able to talk about, I think, some important topics, very timely.
Good, good. Well, I'm very curious, of course, in getting into what we can learn from these disciplines. But I think maybe to start with a little overview. So, specifically when we say disaster psychology, and if you could just comment on that to start with.
Sure. There's a few terms I think that are important to know. It's referred to as disaster mental health sometimes. Disaster psychology or clinical disaster psychology, sometimes disaster behavioral health. And when I was in training at the University of South Dakota for my master's, my PhD, at the time, this was mid to late 1990s, and disaster mental health was like a brand new concept. And it had evolved from a plane going down in Sioux City, Iowa, and then faculty at South Dakota going out with students, graduate students, and trying to help be a part of a response. And then recognizing, like with the Red Cross, there was no official recognition of the need for mental health. That was something that evolved in the 1990s. And so you can point to a few things like that, which kind of led to this creation of a field, if you will. And the difference with something like disaster psychology, the idea is, most professionals are trained to sit in an office and wait for people to come see them, which means that the people who really need their help, in large part, are going to be out in the community somewhere and are not going to seek out that help, or there'll be some barriers, or it could be lack of knowledge or lack of opportunity. Those kinds of things. And so the idea with disaster mental health, if something happens, is to have a relationship with a relief organization like the Red Cross, as an example, that you would go out into the field and be a part of that organizational response and help people with stress management and psychological first aid. And, it's something that is therapeutic, but it's not therapy per se. It's not that traditional kind of relationship. But that's sort of the beginnings were in the 1990s, and it's something that's really grown, but still it's something that even when you look at like coronavirus coverage, mental health is still it's mentioned a little bit more, but it's still very much a backseat to other things. Right. So we have a long way to go.
Yeah. Okay. Well, and I was just reading your newest book that came out in February that does talk about both disaster psychology and positive psychology, which again, for some people that might be kind of a paradox, but I'd be curious just to hear again, your comments on positive psychology, and particularly how these two concepts do marry.
I'll try to be as succinct as I can. And just as kind of an aside, I was trying to do like a brief talk the other day, and it ended up being like an hour and a half. So I'm working on being brief. So please bear with me in that. But for me, it kind of starts with Viktor Frankl and logotherapy, and which is technically outside of the positive psychology framework. If you look at it from that perspective, it predates it. And at the same time I was at South Dakota learning about disaster mental health, I was reading Man's Search for Meaning and learning, about the importance of meaning making. And it seems just the basic text of Man's Search for Meaning is resilience, it's meaning making, and ultimately it's post-traumatic growth. Each of those three things is essential to disaster psychology. So, we talk in disaster psychology, everything is about resilience, resilience, resilience. And, in terms of positive psychology, resilience, post-traumatic growth, meaning making, they're all under this umbrella that Seligman has kind of pulled together, and Chris Peterson, and there were a number of other people, but I kind of liken that to there were these pre-existing threads in positive psychology. The resilience research had been going on since the 70s. We've been doing meaning research since the 60s with purpose and life test. And then it wasn't really until the mid to late 90s that kind of like, oh, well, we have this movement, this sort of positive psychology. And some of the areas were indeed new. He had kind of the evolution of like people really looking at like courage, for example, different character strengths that we really hadn't looked at scientifically much before. But he really pulled them all together and put them in one place.
Seligman you're talking about?
Seligman.
Yeah.
And I kind of look at that was a big contribution, but I kind of look at it like the threads were there. It wasn't like something that he created from whole cloth or something, and a lot of people don't know that. And I think it's helpful to recognize that you can learn a lot about positive psychology from other perspectives, and just sort of recognizing that they use a different language, and kind of bringing it together. And that really helps. And I would say clinical disaster psychology or disaster mental health is positive psychology, is logotherapy, is Franklian thinking, because it's about attitudinal stance under some of the most difficult circumstances. And I always go back to Frankl because it's like, I can't imagine a circumstance more horrible than the Holocaust. And he's talking about these kinds of principles and how much support, how much he is seeing, and how evident that is. And it's kind of like, well, it seems like then we could apply that to anything, anything that we go through as part of the human condition. And in positive psychology, and they talk a lot about happiness and this smiley face, and that's kind of synonymous in some ways, but I think it oversimplifies, because we know, from Franklin thinking, pursuing happiness often leads to an overfocus on that and makes it actually more difficult to attain. And my take on positive psychology is, I think, consistent with Franklian ideas, which is do meaning-based activities. Do, what's important to you, do what you value, live your life in a way that is congruent with your meaning and values. And somebody later asks you, like, are you happy? Then, you'll kind of, oh, yeah, it's like, I feel like I'm where I need to be.
Right.
Whereas if somebody says, like, we talk about in this culture, the pursuit of happiness, like we're hunting a deer or something, like we're just going to go get it. And it's pretty elusive when you're trying to be that purposeful about, like, I'm going to go get me some happiness and, get it and take it home and, I don't know, put it up as a trophy or something.
Mm-hmm. Okay.
Yeah. But just as an add-on to that, The other definition for positive psychology that I often think of is it's the study of flourishing or human flourishing or optimal human functioning. And for me, those two fields, disaster mental health and positive psychology, fit together because simply you're talking about optimal human functioning under the most potentially difficult circumstances. And I think there's just tremendous applicability there for both fields to really be integrated with one another.
Right. Okay. So there's three words that I heard you say at least a couple of times, and it seems like that might be a good organizer and really that confluence of these two concepts, and that is resilience, meaning making, and post-traumatic growth. So maybe that would be a good organizer for us
Sure.
to kind of talk about and talk about. Um, of course, what I would like you to offer us is the extremely simple and completely guaranteed ways to achieve all those, but recognizing that it may be a little more complex than that, but at least to get for our students here to get a sense of what are things that they might be doing to promote resilience, to promote meaning making, and to promote post-traumatic growth in this time. And also, maybe before that, just kind of a little bit of recognizing you have a whole lot of research, like you said, on this airplane accident that maybe started the disaster psychology kind of at least your research and focus on it. And then we've had hurricanes, and we've had oil spills, and we've had tornadoes, and we've had these other things. But to contrast some of that with what we're dealing with now, which is kind of this rolling, global kind of issue. So, what are the areas that you think are definitely we can apply what we know, and what are the areas where we still may be in sort of we're going to have to figure this out as we go along?
Gosh, let me see. There's a lot in there. And so I just try and think, like, there's a lot that comes to my mind. I'm just trying to figure out the best way to kind of pull that apart a little bit. And so, as you mentioned, so our work started most heavily with Hurricane Katrina. And from there, we started researching flood-related response and tornado-related response, and became very involved in the Deepwater Horizon oil spill mental health response. And so we've done a lot of research going back to about 2005 or so. And since that time, here at the University of Mississippi, we've developed a disaster sciences minor. We've developed the Clinical Disaster Research Center, which is kind of an integration of disaster mental health and, I would say logotherapy, meaning making, positive psychology. And as far as like what we know, most people talk about resilience and know about resilience the most, but resilience is one of the most confusing terms in my mind because it's like soup. It's just so much stuff. It's like, well, what are you talking about? Individual resilience? Are you talking about community resilience? I work with engineers who talk about a resilient dam structure or a resilient building. It's like, well, I'm a mental health person. I want to know what makes for a resilient individual. And then you can talk about psychologically, like medically, like, what is it that you're talking about? And some people disagree about even a simple definition like, well, I'll take Bruce Smith's definition, who's also a scholar in this particular area, and he talks about it being bounce back. So the idea with resilience, when something occurs, the idea is to get back to a previous level of functioning, before something has occurred. And one of the things that people don't know, and this is because of movies and TV and all of this, people are actually remarkably resilient. They have a remarkable capacity for bounce back. But when you ask people, they tend to think, oh, well, people will panic and there'll be all these, it's like a smaller percentage of people in acute response, like 10 to 15% may panic. Um, there'll be some people, you talk about fight or flight or freeze. There'll be some people who respond in very adaptive, proactive ways. There'll be some people who hesitate and try to figure out what's happening here, and what do I need to be doing here. This is why preparedness is so important, because you don't want to take time to think about it. You just, when something happens, want to be able to react to it, having gone through a few things. And that we actually know disaster preparedness rewires your brain for that. And there's a lot of cognitive biases we have that actually interferes with our ability to understand that, like, an immediate emergency is an actual immediate emergency. Our brain tries to put it in very simple terms. So if your house is on fire, you might wake up and go, somebody barbecuing? Like, is something, is like, oh, is the sun coming up? Like, what's going on? Your brain's trying to tell you, like, oh, this is a normal thing, and these are the normal things that we know about. And so preparedness helps to overcome that. And so I would say a hallmark of resilience is the preparedness piece. Now, in terms of COVID-19, people, unless you're like a virologist, you're a health professional. We've been preparing here for years, but this is what we do. But we talk more about like flu. Pandemic is one of the things as a culture, and obviously throughout the world, that we can talk about, but we haven't really been prepared for.
Right.
And so you see this kind of coming, and in some ways it feels fast, but in some ways it seems like it's really coming slowly, and we have time to be doing some things. And when all of this is occurring, it's kind of like, how are we going to be affected? Oh, that's still far away. That's not, affecting us here. And, our brain just kind of tries to normalize it. That's over in Asia, that's over in Europe, or what have you.
That's just New York City. That's not.
That's just New York City. That's Louisiana. Like in Mississippi here, it's like, oh, that's New Orleans. It's like, that's Louisiana. It's like, that's 6 hours away. Like, what could possibly happen, or whatever. And just sort of recognizing that, when something happens, it's like, well, why not us? If you say there's a 1 in a million chance of something happening to somebody in the United States, it's like, what is that? That means 400, 450 people, something like that. A given event is occurring for them at that particular moment. And so I tend to try not to focus on uh, the the why of it necessarily. And that's where the meaning making piece kind of comes into the meaning making and resilience. Um, I tend to focus more on the, like, now this is occurring, what is within my ability to control that I can do something about that? And when I start thinking along those lines, I think of resilience, but I'm thinking specifically of like logotherapy, positive psychology, meaning making. I'm thinking of an attitudinal stance. And the COVID-19 is alarming, not just from um, the medical piece to it. And this is something that you can't see, that you take precautions, and it's very scary to realize you could be spreading it and not recognize it.
Right.
But you think about the different values, the polarization in politics, the economic damage that is occurring, the vigorous nature of people arguing over what's fact and what's not. In disasters, misinformation and rumor run rampant. And my best suggestion would be follow the data. Stay with your health professionals. That's what they do. That's why, they spend their careers, learning about these things and tracking these things and giving us good advice. So that's the World Health Organization, CDC, and all of that.
Those are the people that are going to be in the best position to know, even though it's an evolving situation, but they're going to have the best information about what is happening, how to stay safe, that kind of thing.
That's correct. And that's their motivation to do that. And I hear a lot of people like questioning, oh, they're just, doing this or whatever, or we don't see this impacting them in the same way or what have you. It's like, well, that's why we have ethics. That's why there's a whole kind of process for how we go about doing it. A scientist is supposed to look at the data and basically call it like they see it, and to kind of describe that. And it's amazing to me that, we get good data-based informed advice on how to respond, and we disregard that,
Mhm.
and then and so you see a lot of that. I think I would point to right now that that would be a way to really, um, sorry, my monitor's kind of going out a little bit here. I can't tell if you're seeing that or
I
it's
can still see you fine.
okay, great. So if I look like I'm like, what? My monitor just went out, blanked out for a second. But I would say that takes away from resilience. Focusing on the blame, focusing on arguing over things, focusing on, I really don't think there are news programs anymore.
Mhm.
There are like people who are talking heads that are giving opinions and talking from backgrounds that they don't really have any knowledge of directly. And if you're just watching it, you have to be more, I think, aware and more questioning of the information that you're receiving. And that's true if you're on Facebook or YouTube or Twitter or whatever it is. And there's research on this that a lot of people have trouble determining like what is good information from what is not good information. Um,
Okay.
and so there's a lot of
Then
things
make sure
passed
I'm
around.
hearing you accurately here, that rumors and misinformation, that's a natural process for when we're in a disaster. It's not like this is a new thing. This is something that we could say, yes, this is going to happen. And especially since this is so protracted and so large, it makes sense that we would have that. And it also means for us to be resilient, we have to filter better, to know what sources to pay attention to and what not to pay attention to, and know how long to attend, and when you've gotten the information to disconnect, and
Right,
not kind of keep allowing yourself to be overwhelmed by information which is maybe
right,
contradictory, or even if it's the same message, just hearing it bombarding over and over again is not going to be helpful.
right. I kind of look at that as like an erosion.
Hmm.
Psychologically, that's just, you need basic good information. You need to know what to do. And then you need to find ways to disengage and go about your life and have your own routine and do the things that you would normally be doing. Um, and I think a lot of that has been lost in a lot of this kind of back and forth and who's responsible for this and who's responsible for that. And I recognize there is importance in determining, that, okay, there's not enough testing, there's not enough PPE. Um, you want to know enough about that you can try to fix that and correct that and kind of get it where it needs to be. There's plenty of time for blame that can come later, but
Hmm.
kind of in the moment, it's like, what do
And
I need to take care of
right,
myself? What do I
for
need to take care of my family?
you and me, and most of the people watching this, that's probably, there's nothing really that we can do directly right now to impact that. So it's just to acknowledge, okay, yes, that's an issue, that's a concern, but how do I come back to what can I do to be prepared? How do I best protect myself and those
Mhm.
that I care about with the most accurate information, and not get overwhelmed about it, or not get pulled into kind of the blame game, because that's not going to help me.
Right. Right. And blame is a way to kind of discharge, psychological pain. And, oftentimes it just takes us into a wrong direction in terms of like healing and, it takes us away from healing and galvanizing ourselves and kind of figuring out, okay, what is it that I need to be doing
Yeah.
here?
Okay. So I'm hearing more about resilience. I'm really curious about the meaning making, or as logotherapists might say, meaning discovery aspects of dealing with this kind of a crisis. Could you frame some comments more specifically on that, or what do we need to be aware of to find meaning in this situation? And are there things that are helpful and things that are not helpful in that arena.
Yeah, and so I'm going to try and summarize. Let me see if I can summarize a little bit here. So um, our research program is perhaps a little bit different than some others in that of those three concepts that you mentioned, I think meaning is the most important.
Mm.
Of the three, I think meaning is the one that gets the least amount of attention. So when people are saying resilience, 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 and we were talking about, well, what is that? You can look at different scales or measures of resilience that scientists have developed and well validated. And you look at individual items, there are meaning items in there. And when I say meaning, it's like, my life has meaning, or I like you have goal orientation, a sense of significance, a sense of mattering. Um, there's a few scales that are like that, and there's a few scales that are touted as resilience scales, but they're based on Franklian frameworks, or more meaning-based positive psychology frameworks. And so we just started to really say, well, instead of resilience, 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 maybe we need to be saying meaning, 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 especially if they're using elements of meaning to define what is resilient. And there is this sense of like what is causal, but for which goes back, if you're resilient, are you going to perceive meaning? And if you have meaning of I would expect you to have more resilience, but it doesn't necessarily need to be causal that way. So but what is a good way to think about it is that there are a lot of data on this. There is good evidence that if you're able to make meaning out of your circumstances, right? Frankel might say discovering, it's there, the presence of meaning. The idea is it helps galvanize us in a lot of ways. If you have a greater sense of meaning, you have less depression, you have less anxiety, less risk for substance use. People report fewer post-traumatic stress symptoms, fewer acute stress to symptoms, fewer stress-related problems in general. And this doesn't mean that you're not affected by things, but it means that, of the range of potential that you have to respond to something, meaning helps to amplify that and make sure that, you're kind of addressing things with your best foot forward, so to speak. And it's like, well, what is meaning? A lot of people will ask, well, what the heck is that? And in a broad sense, I could say, like, what is it that gets you out of bed in the morning? What is it that motivates you? From a positive psych perspective, there's this concept of flow. And the concept of flow is, these moments we have where we become so engaged in something, we lose track of time, that we're not thinking about other things. We're like mindful in the moment, like completely engaged. And we might get that from being with someone. We might get that from playing basketball or, whatever, where we can get lost. Those are meaning intention kinds of activities, meaning you can make a choice to engage in those kinds of things. And if you know that that's something that I value, that communication with somebody, or that challenge of playing with someone, or that camaraderie, or however it is you define that, then those are the clues. That's what I need to be doing to, to feel good, to feel like I'm making choices that matter. I'm living my life in a way that is consistent with what matters to me. And so I'll often phrase meaning in terms of, are you living your life, making your decisions, solving your problems in ways that are congruent with your values, with where you want to go? We're all walking toward the horizon. Everybody's just going on a little bit of a different trajectory, and you're just kind of trying to make sure, like, am I on my own trajectory? Am I walking my own path here? Or am I walking a path somebody else has told me, like, this is your path, or society, or college, or what have you? Everybody's telling us what our path should be, and it can get very noisy trying to figure out what our direction should be. Something like a COVID-19 will be an awakening for many people. And people will define time by pre-COVID-19 versus post-COVID-19. And they'll be talking about this for hundreds of years. But there will be people who go, they're trying to make some sense of like, well, what does it mean that this happened? I never envisioned this happening. People always talked about it. There are whole movies about contagion and, disease and all of that. And what does this mean for me? And then some people might feel inspired or called into medical profession. Some people might feel called to go into epidemiology, or, oh, I want to do mental health for sure now, because I really see how prolonged quarantining and prolonged social distancing is really hurting people. Um, it's really challenging people in ways that we haven't seen before. Just given the prolonged kind of nature, when is this going to end? We've got the politics, the political side, we've got the economic piece to it. We say around here that there are no two disasters that are alike. And so there are no two tornadoes that are alike. There are no two earthquakes that are alike. Every disaster has its own socio-political, economic, cultural context to it. There are no two instances like in the same areas in the world where COVID-19 is happening the same way. People are reacting differently. Cultures are responding differently. You can see that in the U.S. from state to state. And you can see even the arguing and the kind of back and forth versus science is heavier in some states than in others. This makes it very, very difficult to make some kind of sense of it, and that's one of the meaning pieces is making some coherence of it. And so from a resilience or a meaning standpoint, you can control like your attitudinal stance and how you respond, and you can make precautions for yourself and also for your loved ones, and trying to make sure you're doing the things that you can to minimize risk. And if you have a value such as many of us do, like helping people, then recognizing by social distancing and quarantining, ultimately I'm part of the larger effort to kind of help us all get through this. Like, this is what I'm being called to do. That's another meaning way to look at it. So if the medical professions are overwhelmed, then by gosh, I need to do what I can be doing, for my end of things to make sure that I'm not a part of that problem.
So it's kind of heroic to not rush out and try to help your neighbor rebuild. It's heroic to isolate, even though that might feel like I want to be doing something. In this case, that is doing something, and so that's that attitudinal shift. Because I think a lot of times, for me, it was like, oh wow, when Harvey hit this area, I was able to go down to the George R. Brown and volunteer, and I was doing something. And for much of this crisis, it's been, what do I do? And so now I'm hearing for you, just that the doing the distancing, the minimizing the chance that if you have it or that you could get it, that is meaningful, even though that may be kind of counterintuitive. But that's what we have to look at in the face of this crisis.
Right. And that's also how I kind of equate meaning and logotherapy in with positive psychology, because you can look at some of those character strengths, the different virtues they look at, and the 24 character strengths, and like the values and action survey. And you could kind of say like, you hear a lot of people complaining about being bored and not wanting to stay inside and all these kinds of things. Well, maybe I need to exercise my perspective character strength. Gosh, I'm really bored. Well, maybe I need to exercise my curiosity character strength. I need, and kind of investigate or explore new things. And I say that delicately in the sense of there's a lot of pressure now for people to like learn a new skill, and you should, all of these things you've always wanted to do. And I'm like, some people just aren't going to feel that way, and they shouldn't necessarily pressure themselves to become a master chess player, in like the next 6 weeks or whatever it is. And so some people will feel galvanized, like, I'm going to read all these books I've had on my nightstand forever, and I'm going to do all of these things. And and there'll be some people that are a little bit more natural with it. And then there'll be some people who struggle. And as a part of that struggle, what can help in the struggle is recognizing that this is part of the sacrifice that I can make, part of the challenge, part of my demonstration of courage to take a hopeful attitudinal stance
Mhm.
and recognize that I want to do my part. I want to help people who are helping everyone else. And the best way I can do that is by looking out for my physical well-being, my emotional well-being, as well as, your family. Or, we have a lot of college students here, obviously, so roommates and whoever it is that's around you or in your home. That's the ability to kind of control within your sphere of control.
Okay. Well, we haven't yet talked about very much post-traumatic growth. So I do want to spend a few minutes just kind of getting that, and again, any tips or guidance on how do we be alert to that? And again, not that you can force it, but what are the kinds of attitudes or things that might be conducive to that? First of all, maybe defining what are we talking about there, but then how do you invite that?
It's a great question. Post-traumatic growth is the modern term is coined by Richard Tedeschi and Lawrence Calhoun. It's been around since the mid-90s or so. Obviously, things like meaning, resilience, and post-traumatic growth have been around for thousands of years, and philosophers and folks thinking about, well, what are these things? But the modern science of post-traumatic growth has been around since the mid-1990s. Those are the two key figures. I would also mention Crystal Park and her research at the University of Connecticut. And her work has been essential with developing a meaning-making model for understanding trauma, which I think if we have a few minutes, it would be useful to go back and maybe talk about that. But whereas comparing it to the other two, we know that meaning, resilience, post-traumatic growth are all related.
Mm-hmm.
Okay? There is some overlap because some of the measures they use meaning components in resilience, and they use meaning components a lot in post-traumatic growth. Tedeschi and Calhoun's definition, really in its most simplistic form, the idea is not bouncing back, it's bouncing forward. With the idea that, if I said every cloud has a silver lining, we all have these expressions or these phrases where when things happen, when life hands you lemons, you make lemonade, that sort of thing about how when we get whatever it is that we get in terms of a hand, that we make the best that we can of that. With something like post-traumatic growth, Tedeschi and Calhoun have highlighted multiple areas. And so one might be you go through something like COVID-19, and maybe because of Zoom, and I see a lot of like anti-Zoom and people tired of Zoom and all this kind of stuff, but maybe between that and like FaceTime, you're connecting with people you hadn't connected with, in a while, or maybe you're using some of that extra time to kind of go, maybe I should see what so-and-so is doing and kind of going about that. There is nothing like a disaster to let you know who's in your corner, who really has your back. And, some people, may call and check on you, and you may be kind of surprised by that, just wanting to know how you're doing or worried about you. So there can be that kind of social piece. So some people will grow from a disaster or trauma in terms of the quality of their relationships. And, when I'm teaching these classes, I'll often kind of say, like, when you go through something, when your back is really up against the wall, you should pay attention to who is there, like who is really there through all of that, because those are relationships you really want to cultivate. I mean, those are the people who really have your back. And in a way, even though it's kind of scary to learn that there's somebody you thought would be there, but who is not there, that's important to know also. That can tell you a lot, about the kinds of relationships that you really have. When something happens, so we have the social piece, we have a change in perspective.
Mm-hmm.
most people on a day-to-day level worry about things that make no difference in the big picture. Like for big picture, like life and death kind of, existential matters. We worry about day-to-day paying bills and, okay, I need more money for this and I gotta, finish this project or this paper. And we get very wrapped up in that, where it seems like that's the most important kinds of things that we have going on. And there is nothing like a disaster to wake us up to what is truly important, and to kind of recognize, like, we're all here for a short period of time, geologically speaking. And when something like this happens, it awakens you to what is most important. And so it can really shock. Some people will recognize they're not doing what they want to be doing. They're not going in the direction that they want to be going in. And so this may be a call to shake that up and change that. And that in and of itself could be uncomfortable and can cause some search for meaning. But I don't think that's maladaptive. In mental health, we want to quickly diagnose and pathologize and stuff like that. I think when you have a life-changing kind of event, you need to sort of listen to it, and I'm kind of looking at this quote here I have up. One of the themes of our center is a quote from Frankl, which is, "Every situation emits a call to which we have to listen." That's post-traumatic growth in a nutshell, in my mind. Because something happens, we say, why me? The meaning making kind of piece, like we need to make some sense of it. And that's where we use Park's model and Frankl and, to try to better understand what brings people through, what helps elevate people through a distressing event. But it sounds odd, but when I'm teaching and when I'm just kind of talking with folks, disasters or aversive experiences are opportunities for us to show our character. And I mean that you can look at that in the positive psychology, the character strengths. It's an opportunity to question what is meaningful. Am I where I would want to be? Am I spending my time the way I want to? Am I spending it with who I want to be spending my time with? And from a perspective and a larger, bigger picture kinds of things, it can change just what is a good day, and so it can become a very simple matter, like, oh, it was a great day. I touched base with somebody I hadn't talked to in a long time.
Mhm.
It's like we overlook these kinds of things consistently because we're looking for bigger things. This is why happiness is so elusive, because we're like, I want that raise, I want that promotion, I want to graduate, I want this, and I want to get I want to be happy. If I just get this, I'll be happy. We tell ourselves that all the time, and we get whatever it is that we need. We start getting used to it, we acclimate to it, and which means that we then want more, ultimately. And
Right.
that's why happiness is so elusive on the one hand, and why if you're pursuing and doing more meaning-based kinds of activities, it's like you can just focus on doing that. If my value is to help people, what are the ways that I can do that? And how can I do that even if I'm quarantining? Oh, I'm quarantining. That means I am helping people. I am socially isolated. That means I am helping people.
So let me see if I'm hearing this accurately. Part of what I'm hearing you say is that kind of just the way that we usually think, it's just the normal way of thinking, is we focus on something which is usually fairly trivial in the big picture. It's like, oh, I've got to get this work project done. If I don't, my boss is going to be mad at me. That kind of thing. That's what takes our consciousness and our focus. And when we have a disaster, the trivia is kind of the potential for the trivia. We could get more focused on the trivia, but there's the potential for the trivia to be washed away and to say, what's really, really important. And the disaster, because it's not the normal state. In the normal state, it's easier to just say, oh, the trivia is important. In the disaster, we can't do that. And it's not a guarantee, but it is an opportunity to recalibrate and to say, what are the values that are really important? Who are the people that are really important? Am I doing with my life what I really want to be doing, or what really makes most sense for me to be doing.
Right. Right. And I liken that to, if you're talking about a disaster, whether it's natural, technological, whether you're talking about pandemic, I would also take those same kinds of ideas for, um, if we're dealing on a more day-to-day basis. We have sickness, we have relatives who get sick and they die. We have even things that are regarded as positive, births, graduation, all of these things can induce a sense of shock, or just kind of like, well, what do I do now? I've been so focused on this, moving forward. And so it's that same kind of attitudinal stance, that same kind of sort of recognition. Um, you can also incorporate a good deal of the mindfulness kind of practice here, because something like a crisis or a disaster will pull you into a moment like nothing else will. Like, it will make you present to a moment like nothing else will. And, I kind of go back to that Frankl quote. I think those can be opportunities for us to learn more about ourselves, what we're able to do. People learn about their internal strengths. I didn't realize I could go through something like that. And it's like, well, when life asks you to do something like that, my money is on you. A lot of people sometimes underestimate their ability to do things, or they'll underestimate their strength. My ability, or my belief, is for people and their ability and their internal resources ultimately to come through. That doesn't mean that they won't need some help to do that. It doesn't mean, social support is kind of the number one protective factor, really, for most any kind of stressor. We also need to be aware that feelings of being meaningful or resilience, they can come and go. So sometimes they kind of wax and wane. So sometimes you might feel, I'm doing okay, and then you might get hit with a thought or an experience where it just kind of shakes you again. And so that's one thing to kind of recognize, is they can be sort of transient in a way, come and go. And the other piece that comes with that is, we often talk about, like, oh, you have meaning, or oh, you have like, it's an end point, and then it's like you're done or something. And it's like, okay, or you're resilient, like, across the board. You have meaning across the board. You might have a lot of meaning in your family, but if you lose your job during this pandemic and having trouble making ends meet, and worrying about these kinds of things, um, I mean, it's an entirely different, different sort of sense. So you're kind of like, well, things are going well. I feel okay with my family, but engaged, resilient. But then, like, I have no idea what I'm going to do.
Right. So you have to revisit. It's not like, oh, hey, I've achieved resilience, I've achieved meaning, I've achieved post-traumatic growth, and then you're done. There's, we're continually cycling through these things.
I think it's a process. I look at it as kind of like a trajectory, if you will, and there are lots of things that can happen that can kind of change that up a bit. And I think I just think we need to be more attuned to that, because a lot of times we're just talking about, like, oh, do these things and then you'll feel better. And it's like, well, it may be a little, that is the pathway to feel better, but it could be a little rocky. It could be, it could take a little bit more effort maybe than some other folks might need, because everybody's different. Everybody responds differently to, different stressors and different interventions, for stressors. And so, I think there's a lot of that individual variability that we need to sort of step back and kind of appreciate better.
Yeah. And the other piece, just as I was thinking about what you were saying, and tying it to the earlier bounce back. Well, to bounce back, that means you have to hit the floor before you can bounce back. So there is going to be some downward motion before you can bounce back, or you have to hit bottom before you can bounce forward.
Right. Well, some people think that's part of the problem of the definition of resilience, I think, because some people argue it's like you're a Superman or Superwoman or something, like, and you're stress resistant.
Mhm.
You can't go through something like a COVID-19 or a tornado or a hurricane or an earthquake and not be affected. I mean, you're a human being. You're going to be affected. Now, you might be doing relatively well, all things considered, and sometimes people will feel heroic and they will feel like, I know what I need to do, and I'm, going to put my family on my back, and we're going to kind of get through this. And so they may have these kinds of responses, but even those responses will weather, they'll change, over time. People will lose momentum, other people will gain momentum. It kind of comes and goes. Um, but yeah, I think, just in terms of that kind of variability, I think it's helpful to think in terms of how is it that I'm being affected? You have a death in the family, you're not unaffected. Even if it's a distant relative, it's affecting people even closer to you and coming closer to you.
Mhm.
Even if your house isn't damaged in a tornado, but it affects your region, you're still affected by it. It still has an impact on you. So I think recognizing that, so I don't really subscribe to the stress resistant kind of piece. It's almost like if you're resistant to that stress, then it's not enough to have really caused a problem for you. And like, it's like, are you really being resistant or bouncing back?
Or are you avoiding the reality of what's going on? A different kind of maybe problem of just not seeing what's really happening.
Sure. I kind of liken it to, somebody throws a weight on you and it makes your knees buckle. Like
Mhm.
you're going to have to brace for it and try to sort of figure out, like if you're carrying, so I kind of think of like Atlas on the large scale, but
Mhm.
if you've ever had a friend and moved a couch, something like that, even something small like that, you're kind of like, well, okay, well, we've got this thing, but it's like stuff to kind of brace and sort of move a little bit and respond to. I think it's a much more useful way to think, but also recognizing that there are strengths that I can bring to bear, on whatever the circumstance is. Like you have external resources, you have internal resources,
Mhm.
and oftentimes we're just not thinking about them, or for whatever reason, we might have good social support, for example, but we choose not to use it or choose not to reach out, or we're afraid to be a burden.
Yeah.
Um, on someone, and that's why we have social support. It's okay to ask for help. And in this process of resilience, one thing I would want to mention is something that I learned from one of my instructors at South Dakota, which is he considers traumatic stress to be a normal response to extraordinary events.
Mhm.
And the thing about that, why I think that's so important, is because many people will experience like normal stress responses for the kinds of things that they're experiencing. Some people will, you could say, experience clinically significant depression or anxiety or what have you, but you're not going to go through this and be unaffected. You're going to be impacted. And we don't do a good job educating people on, well, what are expectable responses to extraordinary circumstances? Like, what would you expect to see? And, how would you expect to kind of bounce back and to, potentially move forward? Um, so there's a lot of contextual kinds, there's a lot of nuance, I think, that is sort of missing from these discussions. And so what happens is, um, I think it's great that there's information out there like CDC and World Health. They're putting out these like handouts and things, and we've collected a number of those and put them up. But it's almost like you could experience these things during this pandemic. Here's some things you can do to feel better, and that's good. But it's missing that kind of contextual sort of piece. Like, well, what if I try this and it doesn't? Well, maybe there should be a connection there. Like we lobby for, maybe you should be doing things that are consistent with your values, and you prioritize it. So they're some of the most important things.
Mhm.
So maybe reaching
It's
out for
highly
social support.
individualized,
Yeah,
right?
yeah. And so there are those kinds of meaning related pieces, I think, that is missing. It's not just, well, what should you do? It's like if you don't value exercise and you've never really kind of gone out and ran and stuff like that, that's going to be a little bit more difficult for you than, well, maybe it's you have a tremendous value of being outside in nature, and then you can phrase it in terms of going for a walk and still get your exercise. But if you phrase it as exercise, And it's like, oh, I never really thought of myself as like a, you know, I don't know, a workout person or whatever. So it's about using the language that resonates the most with people, and that's what's kind of missing from that, I think.
Mhm. Okay. Well, I think we probably need to wrap up, but I want to just thank you again, and let our audience, our students know, in the course guide we will have some of those references and resources. So if you want to take a deeper dive, you can look into that. We'll have that in the email that accompanies this video. So look for that. And also, the next class will be the live class, and that will allow you to ask any questions. Dr. Schulenberg won't be there, but if there's any questions that I can answer, and again, we'll have more references and resources. And let me again, Stefan, I know you're very busy, you're very active, you've got a lot going on, and for you to take time out and to enlighten us with your knowledge and your questioning nature of recognizing, there's not just necessarily do this, but it's like, here's things to consider, and here's the questions that you might need to look at, rather than here's the strategy to just implement. And I think that was very helpful, and I appreciate your time and energy.
Sure, my pleasure. My pleasure. Appreciate you having me on.
Thanks.
Yeah.